Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast. This month's episode is titled 85 Years of Making a Difference, It All Matters. 2025 is a milestone year. It marks the 85th anniversary of the American Diabetes Association. For 85 years, we've led the charge as the nation's leading voluntary health organization, touching the lives of millions with a mission to prevent and cure diabetes and to improve the lives of all people affected by diabetes. In today's episode, we'll take a look back at the ADA's legacy of groundbreaking research and how it shaped the programs and resources we offer today. We'll also walk through some of the resources available to help you and your loved ones better manage or prevent diabetes, including nutrition guidance and the National Diabetes Prevention Program. I'm Dr. Neil Skolnik, Professor of Family and Community Medicine in the Sidney Kimmel Medical College of Thomas Jefferson University, and joining me as always is my co-host.
Hi, I'm Dr. Sara Wettergreen, an Associate Professor at the University of Colorado Skaggs School of Pharmacy and an Ambulatory Care Clinical Pharmacist.
And joining us today are a few special guests from the ADA, including Dr. Marlon Pragnell, PhD, who is the Vice President of Research and Science and oversees the development of the scientific programs for the ADA's scientific sessions and leads ADA's research programs. Charlene Wallace, who is Vice President of Diabetes Prevention. Stacey Krawczyk, Director of Nutrition and Wellness. She is a registered dietitian. Let's jump in, and as we talk to each of you in turn, give us a little background about yourself, where you fit in before you tell us about the programs that you run. Marlon, can you go first, sharing first a bit about the context in which you come at this from, and then tell us about ADA's research efforts over the last 85 years. Not much, I know, and how they've evolved over time.
Sure. So I oversee ADA's research programs, so all the research that we fund, all the grants that we bring forward, and also I'm very much involved in our annual scientific sessions. This is the massive meeting that we have each year that brings the diabetes world together to talk about the latest advances and share this information. So it's great to be here on the podcast.
Marlon, when you say these scientific sessions, and as clinicians, we all know about it, and I know a few people attend, can you give our audience how many physicians, diabetes educators, nurse practitioners, PAs, scientists from all over the world usually show up for these scientific sessions?
So about 12 to 14,000 people come. These are people from all walks of diabetes life, clinicians, researchers, educators. It's 4 amazing days packed with research, packed with science. And, people come to learn about the science, but then how to apply it to their clinical practice and how to improve the lives of people with diabetes. So it's a very exciting time. It's the latest data that comes out.
It really is. And I have to say, having attended those meetings for years, you come for the science and then you keep returning for the relationships. Because what I have to also say is that people in the diabetes world are just the nicest, most mission-dedicated people I've ever met. So there's this sense there of enormous excitement about a shared mission, and with that, just a warmth, because we share in doing something worthwhile.
Exactly. So people come to connect, but also too, in that connecting and learning all the new science, people start to connect the dots, and then that's where you have innovation and new ideas come out. And that's where we see the whole field move forward. So as we support research, we fund research and grants, and we advance ADA's funded research, we bring the whole scientific world together. Everybody coming to talk about the latest advances, the latest clinical trials. And that then pressure tests the ideas, that the knowledge. There's lots of discussion. And what we end up with is just evidence-based science that we can really rely on as to take forward to improve the lives of people with diabetes.
I love the term you use, pressure test science, because one of the more interesting things that happens isn't just the presentations from the front of the room, but the questions that are asked at the end of the presentations. There's always a lot of time when scientists and clinicians from all over the world, as far away as China, Taiwan, Poland, you name it, stand up at that microphone and ask the toughest questions you'd ever imagine of the presenters, and truly a pressure test.
Love that. I mean, that's one thing we've been doing. Every time I develop the program for the scientific session, we make sure let's have lots of time for discussion, questions, and so people can get up and engage. And also, too, what we're seeing as well is people love debates to see the different perspectives and so on, and really kind of hone down to the kind of the message there. So really important.
And can you tell our listeners the range of things that are presented, even with a couple of quick examples? Because sometimes people may think it's just about new medicines, but it's not just new medicines. Do you want to share that range that goes on there?
Sure. From everything from basic science all the way through to implementation and clinical care. Diabetes affects the whole body, and also affects families, environment, and so on, and our living environment. So we have research that's presented that is very basic science, understanding, for example, the physiology of the beta cell. We have research like clinical trials, reporting on the latest therapies, the latest drugs that have been developed and their impact on and their benefits in diabetes. We have behavioral studies, psychosocial, behavioral interventions and so on to understand what are the impacts on quality of life for people with diabetes and diabetes distress. Also policy, economics, the economics of diabetes as well, healthcare implementation, quality improvement, the whole range, the whole spectrum. And that's why it's so valuable, because people can come to the meeting and learn within their area, but also across the areas. And that just creates so much more knowledge and creativity and advancement for the field.
It's so exciting hearing all of the translation of research. It starts at laboratories and moves to patient care, and we're seeing all the full spectrum of that throughout ADA's research presence. I loved hearing your enthusiasm about the meeting on our last episode as well, so thank you for coming back to continue to share that message. Today, we're also looking at the current ADA offerings, and we wanted to include research again today because we know this serves as a foundation for so many of the resources and programs that ADA offers. Could you share a little bit more about your experience in seeing how that research foundation from ADA supports the patient-facing materials that you see on the website?
Yeah. So basically, ADA has been funding and advancing research for 85 years. Right, and each year, all research is built on previous research, so evidence-based science. So that early research, and now we see it's not in the textbooks. All that science is in the textbook, but that is the foundation from what we've built. New knowledge, a new understanding, and these areas are, for example, like the DPP, for example, which I think Charlene may talk about. Nutrition. We've been funding nutrition for many years, and also too, we've been providing the scientific sessions has been a forum for discussion about nutrition, a forum for discussion about behavioral, exercise and behavioral interventions and weight loss and so on. All the different areas that are discussed, and also to this knowledge finds its way, or it's the best, most relevant knowledge gets into the standards of care. And that provides a benchmark, really, that solidifies what we know about diabetes and how to care for you with diabetes. And all that science kind of feeds into that. The ultimate goal I see of research is to ultimately impact the standards of care and teach us how to better take care of people with diabetes and cure and prevent the disease.
Thanks for sharing that, Marlon. I think it's just always so reassuring to hear the level of evidence that's behind the recommendations. If you're a listener and you're thinking about the recommendations you receive from your own medical team, to me, it feels reassuring to hear the level of research, all the discussions that happen, the debates that happen that form those recommendations. So you know that your implementation, the medications you're receiving, the guidance you're receiving from your dietitian or your diabetes educator, that's all coming from this strong body of evidence. So thanks for sharing so much about that, Marlon. Switching gears a little bit, when thinking about that evidence, we know that evidence also leads to changes in practice. And as you alluded to, Marlon, that changes things like the standards of care. And over the last 85 years, so much has changed, even thinking in the last 10 years, how much has changed. So, thinking about that, we've seen a significant rise in that time, over 85 years, in the prevalence of type 2 diabetes and obesity. Charlene, can you tell us about the ADA's role in the National Diabetes Prevention Program, how it came to be, how it helps people today prevent or delay the onset of type 2 diabetes, and starting off with a little bit about your own role at the ADA as well?
Sure, yes, I'm happy to. Charlene Wallace, I'm the Vice President for Diabetes Prevention here at the ADA. I've been working in diabetes prevention, frankly, since the first standards came out around the national DPP, and have been so excited to be able to be in this role and lead our efforts around diabetes prevention. Prevention is one of the keys in ADA's mission. You know, when you look at ADA's mission, that's first and foremost. So we really do care about identifying and finding ways to be able to prevent type 2 diabetes. And there has been a significant increase in the number of folks that have been diagnosed with type 2 diabetes. And the ADA has been very instrumental in looking at and supporting the reduction and bending that curve. And this was identified through the Diabetes Prevention Program, which was a study that was completed and found that people who utilize this diabetes prevention program, it's a lifestyle change program, could reduce their prevalence for type 2 diabetes by 58%. And if they were over 60, then it's a reduction in 71% of type 2 diabetes. So it was quite significant. This was a piece that was very clear that the evidence truly supported. And the ADA has been supporting these efforts basically from the get-go. ADA was part of the first Ad Council campaign that was put out to encourage folks to know their risk and to enroll in a lifestyle change program. Obviously, this is because of the strong evidence base. This is something that is built within our standards of care and helping folks know how to treat people with prediabetes or who are at risk for type 2 diabetes. And the risk test is also extremely instrumental in this work as well.
That's so important to think about. And I feel like this topic was just a perfect transition from thinking about evidence informing how care is delivered. You mentioned that the Diabetes Prevention Program is a lifestyle program. For listeners who may not have heard about it before, what are some components they would expect to participate in or learn about through the program?
Sure, great question. Yes, within the Lifestyle Change Program, there's a focus on making small changes, not something that's going to radically upend your everyday life, but making small changes that truly make a huge impact in your lifestyle and your health ultimately. So things like reducing your weight through improved nutrition that we'll hear from Stacey about, as well as increasing your physical activity, aiming for that 150 minutes per week of physical activity, but also things like stress management, making sure that you're getting good sleep, and things like that. So the program is a year-long program. It starts off with weekly sessions to be able to learn some of those foundational skills and understand how to make those small changes. And then it's followed by a maintenance course that allows for participants to make mistakes, trip, fall down as they're trying to make these changes for their lifestyle, because we know lifestyle is so difficult to make changes in. And so we have to have time to be able to try some things, figure out what doesn't work, and then figure out what does work and be able to stick with those. So it's a really exciting program that allows you to kind of do some self-experimenting to see what works for you, for your culture, for the way that you work within your community, family, and work life.
I think that's so important to focus on those small changes, as you said. And really, when I think about lifestyle efforts, we're thinking about the things that make it stick. Those major changes, you hear lots of New Year's resolutions, and I know we've talked about this on previous episodes, but when you make too big of a goal, it's hard to stick with. Or I might set a goal to become a marathon runner, and I don't love running. I can make myself do it, but I don't love it. So is that something I'm going to stick with long term? Probably not. But as you said, Charlene, finding those trips and having those slip ups are things that help you to learn more about yourself too, and learn, well, maybe I can't stick to that consistently, but what can I stick with consistently? So it's great to do that in the setting of a supportive program like the diabetes prevention program, where then if you do have that trip, helps you keep getting back up and going to the next step. When thinking about that program, if a listener is interested and wants to learn more, I'm curious, how does someone qualify and where would they go to sign up?
So that's a really great question. Folks can go to the ADA website, so diabetes.org/DPP, and be able to learn some more information. One of the really great things and resources that the ADA provides is when it comes to eligibility for the lifestyle change program, the ADA's risk test is one of the qualifying factors for the national DPP to get people into a lifestyle change program. So to qualify, a person needs to, number one, be over 18. They have to qualify for the program either, number one, by the ADA risk test, which that's the test that's used by all national DPP programs across the country, or they can qualify through a qualifying blood test. And then participants also need to not be pregnant, because we want to focus on the health of the baby. And then also look at folks that are not already diagnosed with either type 1 or type 2 diabetes. So it's a really great opportunity for people to get involved and make those changes.
Well, thanks so much for sharing that, Charlene. That's great information to have. And even if our listeners might be people who are currently living with diabetes, this could be a good resource to share with friends or family who might want to learn more about their diabetes risk and enroll in a program that could help them potentially prevent developing type 2 diabetes. So thanks so much for sharing about that. Last but not least, we want to talk about nutrition. Nutrition, we know, is a key part of both managing and preventing diabetes, from the day-to-day lifestyle in terms of managing your glucose if you do live with diabetes, to hearing about how it's an essential part of the lifestyle components of the diabetes prevention program. So we'll hand it over to Stacey with this. Stacey, can you first introduce yourself again? Thanks for coming back to join our podcast. But then walk us through how the ADA's nutrition guidance has evolved over the past 85 years. Not a short time, a lot of changes to cover in there. And we know we've come a long way already in that time. We think about the strict food exchanges to more personalized eating plans now that consider other conditions someone's might have, their culture, their preferences. And then on top of that, if that wasn't already enough, share a little bit more about the nutrition resources from ADA to help support people as they learn nutrition. Thanks, Stacey.
Thanks for having me. I'm so glad to be here. Stacey Krawczyk. I lead the nutrition team at the American Diabetes Association, and we have an awesome group of registered dietitians that really focus on how we can interpret the standards of care into practical applications, whether it be recipes or resources or materials that healthcare professionals can use with their patients. And so we know that as food and nutrition science continues to evolve, our practical recommendations also evolve alongside. As you mentioned, we kind of started through this whole journey of 85 years, weighing portions, the exchange system, carb counting, and pretty much everything in between. There's been several eating strategies that people with diabetes have used over the years. And as with all self-management opportunities, the one that works best is the one that works for you. Some people still use very detailed meal plans like the exchange list because maybe that's what they were taught when they were first diagnosed and they're comfortable with it. But for newly diagnosed folks in 2025, we typically encourage type 1 folks to match their carb counts to their medication and type 2 folks to use the visual representation of the diabetes plate. In both instances, monitoring is key so you know how your body responds to the food you eat, and you can make the informed decisions on what approach works best for you. Now, we use the nutrition consensus as really our guidance on what those plates should look like based on your personal preference, your culture, your abilities, to cook in the kitchen, as well as your co-occurring conditions. We have the 7 eating patterns described on diabetes.org, and these really are the what to eat. And then we talk about the diabetes plate on the how to eat, how it's represented on the plate.
It's interesting. Things have evolved so much, and eating is both simple and complicated. And I love the visual representations, which try to simplify things. But I've been very impressed by how much dietitians have to offer our patients. And when I've referred patients to see either a diabetes educator or a certified dietitian, there's a lot that goes into understanding your individual response and what is healthy. Does that make sense?
Oh, absolutely. I think that's where, it really truly is a team approach. You have subject matter experts like dietitians who are able to take what the recommendations are and then work with each particular person through their, lens of culture and their abilities and what their preferences are, any food allergies, any other co-occurring conditions, and really kind of help work with each individual to come up with a plan that is something they're going to be able to feel comfortable with, that they can stick with. Because again, as I mentioned before, the plan that works best for you is the one that actually works and that you're going to stick to. I think that's what's great about a healthcare team approach, is that you leverage the expertise of all of the folks on the team to be able to provide the best care for each individual.
It really is true, with the patient in the center of that team and all of us there advising them. And I've been so impressed with Charlene. We focused on lifestyle and its benefits for prevention, absolutely true. But those benefits don't stop applying once someone has diabetes. And when people are referred, and there's great evidence that when people are referred to a certified diabetes educator and there's renewed emphasis on exercise and diet, often the effects of that on someone's A1C, the measure of sugar control, is as much as you get when you add an additional medicine. And so it's such an important area. Stacey, thank you so much for informing us about what's available through the ADA with regard to nutrition and wellness. I wish we had more time to cover all of these topics in more detail. We're just touching the surface, but our listeners should know there's a lot more information on the website. It's been a wonderful discussion. Thank you, Stacey, Charlene, Marlon, for so much you've added for our patients. And before we close, Sara, I'm curious if you have any final thoughts putting everything together.
As I hear all of the discussion, I'm reflecting on how incredible it is to witness the changes that have occurred in the last even 10, 20 years, but 85 years. So many advancements in practice fueled by research that lead to implementation of things like the diabetes prevention program and support evidence-based nutrition recommendations. So all of that we continue to talk about in our other episodes, but I would encourage everyone here to go to the diabetes.org website and use other resources from the American Diabetes Association to continue to learn more and to get the support that the American Diabetes Association has provided for 85 years.
It sure is true. Sara, it's hard to even remember how things were 20 to 30 years ago. It's daunting to think about things longer than that, but even 30 to 40 years ago, just as a few examples so that we really appreciate how far we've come. We didn't have finger stick blood sugars routinely. Really, it's just over 30 years ago, over 40 years ago, people were dipping their urine to check to make sure that their sugar was not exceeding the kidney threshold for spilling sugar into the urine. Now we think about checking one's blood sugar through finger sticks as getting to be kind of old because we've moved toward CGM, which stands for continuous glucose monitoring, as I think many of our listeners are aware of, that allow us to have a small little device the size of about a quarter just on our arm and have that continuously reading out our blood sugar on our smartphone. When we think back just 30 to 40 years ago, there was not much available in the way of oral medicines. We had metformin was new on the scene. We had sulfonylureas, the first generation of sulfonylureas that had a lot of hypoglycemia attached to their use. And the idea of knowing that we could actually decrease the likelihood of developing heart disease and kidney disease and retinopathy that leads to blindness and strokes and neuropathy, peripheral neuropathy. All of that was only discovered in the 1990s, that good sugar control could yield all of these outcomes. And it's only in the last 10 to 15 years that we've had the advances that lead to near-term decrease in heart attack and stroke and other outcomes that are so important. So we, and when I say we, it is all of us. It is ADA, people focusing on prevention, Marlon, people focusing on the research, Stacey, people focusing on helping understand the intricacies of nutrition that have led all of us to benefit from so much that has been done. And it is humbling to be able to be present here at the time of the ADA's 85th anniversary and to be able to talk as a team about how far we've come and to reflect on how every advance in treatment, every lifestyle change, every policy win, all of that matters and all of that accumulates over time. Our hope is that after listening to this episode, our listeners feel empowered with knowledge, resources, and support, and also feel that you all have a true partner here at ADA when it comes to managing diabetes and preventing diabetes. We want to thank you for listening today. For more info on the 85 years of achievements, go to diabetes.org// ADA85. That's diabetes.org/ADA85. If you have any thoughts you'd like to share, leave us a voicemail by calling us at 703-755-7288. Again, that's 703-755-7288. We do hope to hear from you. For the American Diabetes Association, I'm Dr. Neil Skolnik, and thanks for listening.